Hello, welcome to this live broadcast on QTV. I am Mamadou Mboj. This program is organized by the National Social Protection Secretariat, and we're here really to raise awareness about the National Social Protection Policy and their mandate. And part of discussions obviously will include all the roles that they play and the mechanisms they have in place, the coordinating roles and the mechanisms. I have three gentlemen here from the Secretariat who would help me discuss some of these issues. On my immediate right, I've got Mr. Malang Jawo, who is the Communications Officer. And on his right, we've got Mr. Phyllis Suso, who is the Social Registry Manager. And on my left, we've got Mr. Musa El Sonko, who is the M&E Coordinator, the Monitoring and Evaluation Coordinator. Gentlemen, welcome to the program. Okay, well, thank you. It's your program. Maybe you should be welcoming me, really. So, our program. Cheers. So first, just give us a summary of the National Social Protection Policy, which we are here to discuss to kick us off. Okay. Mr. Suso.
Okay, I'll go first.
Yes.
Thank you, Mr. Mboj. It's a pleasure being on this program. Like you said, my name is Phyllis Suso, Social Registry Manager at the National Social Protection Secretariat. Basically, we are here to raise awareness about social protection generally and our mandate as a secretariat. In February 2016, the government of the Gambia adopted or approved the National Social Protection Policy with the overarching vision of providing an inclusive, integrated, comprehensive social protection system that will address the varied needs of the poor and vulnerable in this country, but one that will also contribute to human development in this country. The policy was formulated on the backdrop of a number of challenges in the sector, including weak coordination. Government observed that there was huge fragmentation when it comes to social protection interventions in this country. You have various institutions delivering assistance to various segments of the community that are not talking to each other, often leading to overlaps and duplications in some instances. There was also the problem of weak monitoring of the systems. There was limited data, quality data to monitor what programs are going on. The issue of capacity, both at the administrative and technical levels, were also observed. There was also the problem of funding due to the limited fiscal space of government. Expanding social protection to all the vulnerable and poor people in this country that deserve it was an issue. So against that backdrop, government decided to approve the National Social Protection Policy to help improve social protection in this country.
Yeah. Anybody want to add on to that, Mr. Jawo?
Yeah, thank you so much, Mr. Mboj. And like Phyllis Suso alluded to, there is widespread poverty in the country, which is not hidden. And government decided to take measures in order to try to alleviate poverty. And that is where the social protection policy is driving at, trying to remove poverty and vulnerability in the country. I know it's a huge task, but it is not something that is impossible, because if you look at what he has said, we have numerous interventions going on in the country. We have different support programs that are coming up, but these programs are not talking to each other. So eventually their effectiveness and the efficiency would be lacking. So the policy, that is what it is driving at, and also strengthening the different institutions and the capacity to be able to provide this assistance. So therefore, the policy is here to alleviate poverty and vulnerability. Raising awareness on it is very important so that people understand and they are able to operate based on the dictates of the policy. And that is one fundamental function of this particular program. Yes, thank you.
Absolutely, and he was the coordinator, M&E. I suppose a well-coordinated machinery will help your job, wouldn't it?
Yes, thank you very much, Mr. Mboj. I am Musa El Sonko, the M&E coordinator at the National Social Protection Secretariat. I think I would just digest what they have been saying. If you look at the National Social Protection Policy, it's trying to address the issue of coordination in the country in terms of social protection interventions in the country. Actually, we must admit that social protection has been in existence in this country from so many years ago, well before the Secretariat or the policy was established. However, we need to note that also with the establishment of the policy or the development of the policy, it is trying to put social protection in a coordinated framework so that people would see the efficiency of their activities and interventions, so that there is limited overlaps, there is limited fragmentations, there is synergy in programs that we implement. This is basically the point on which the policy is anchoring on. And this is why the M&E there comes in to see how best do we put things in perspective, move in the same directions, instead of others moving east, others moving west, so that coverage is well increased, so that we reach more people efficiently, and also we know where are they. He talks about the vulnerable groups. Where are they? We need to know who are they. How do they receive social protection interventions in the country? These things need more monitoring and evaluation. Basically, this is why the policy is anchoring on those thematic areas to see how best do we improve our activities in a coordinated way. So others may hear that social protection is in existence, but now we are talking of social protection reform in a more coordinated and efficient manner.
Absolutely. So now do I take it that the Secretariat would be the central authority that would implement, is it the central coordinated institution? Yes. Out of all of these other stakeholders, if you like, in this?
Yes. Okay, then that means, okay, we have that in our points, but the National Social Protection Secretariat was established late 2019. This was around November when the first staff of the Secretariat was appointed. In 2020, we all know what happens in the world, not in this country. There was a strike of COVID everywhere in the world, so the Secretariat could not function properly. Starting late 2019, 2020, there was an outbreak of COVID-19. Then the whole mandate of the Secretariat, or the purpose of the Secretariat, is to assist or help the National Social Protection Steering Committee in providing that coordination mechanism, in providing the overarching coordination mechanism or the stewardness of social protection in this country, so that social protection activities are well coordinated totally. In essence, it is to provide the coordination of social protection activities and interventions and programs in this country for all spheres of life. If you look at social protection, it's cross-cutting. It is not only one domain. So the National Social Protection Secretariat, it is under the office of the Vice President, so that it will have that strategic coordination role, the power to convene other stakeholders to come forward and then listen to them, so that all programs are well coordinated and then we move in one direction. So this is why the Secretariat was established. Today, the Secretariat has staff. We are well staffed now, I can say, and then we are trying to move forward. This is why we are trying to do our communication here today, so that people are enlightened and know where the Secretariat is before Phil would come in for the policy.
Okay, all right, absolutely. So now we'll go into the coordinating mechanisms, isn't it? Because we were just talking about setting the background, the fragmentary nature of things, of all these agencies. So give us some of the coordinating mechanisms in place to make sure that we harmonize things much better.
Okay, thank you. Like I said, the policy recognized that there was no central body responsible for coordinating social protection efforts in the country. And so government decided to set up the National Social Protection Secretariat in 2019. And to help them effectively carry out their mandate, they are expected to develop certain coordination systems. Among them is the Gambia Social Registry, which I head. basically the social registry, maybe we'll go in that, is a database that is going to help coordinate the identification of potential beneficiaries for various social assistance programs. We understand that when programs are about to be implemented, they undergo a delivery chain or a delivery process, which involves trying to identify who are your beneficiaries. You first collect information on a whole lot of people and trying to see who among those people are worse off, so that they are the people who are more deserving of your support than others, especially if you have a budget limitation. And then they go to the next stage of deciding who to enroll in that program and providing the benefit to them, whether it's a cash transfer or any type of support that they are giving. And then they go into the actual implementation of paying these benefits or giving the services to the beneficiaries, and also managing any case or complaints that would come out from their implementation. So the social registry is one mechanism that is going to harmonize the process of identifying potential beneficiaries for social protection program. So our hope is that all social protection interventions will come through the National Social Protection Secretariat and use the social registry data that will inform who is poor and who is not poor, who is a disabled and who is not a disabled, who is vulnerable and who is not vulnerable, so that we are able to say program X is intervening in this region, program Y should intervene in another region. The problems of overlaps and duplications would be addressed. There is also a GRM system that we are trying to establish. We understand in the provision of social protection services, people have issues, people have complaints, whether this is about the benefits they receive or the conduct of the people who are involved in this programs, or whether it is about gender-based violences or whatever. But we know that there are people always have complaints, grievances in the process of implementation of this program.
That's it. We'll go more into that a bit later.
Okay.
But here with identifying
the mechanisms.
Yes, the mechanism. And who is eligible for what? How do you set sort of what they call, is it the social protection floor?
Okay.
Is it income based? How does that work? Who
Yeah.
is eligible?
Yeah. So who is eligible for what program depends on various programs. At the National Social Protection Secretariat, we don't set eligibility decisions for programs. But what we do is we facilitate the identification of their beneficiaries. So programs can come to us and say, we need a list of extremely poor households in URR. They can come to us and say, we need a list of female-headed households in CRR. They can come to us and say, we need households that have disabled. And we can manipulate, we can mine our data set and provide you this list at the click of a button. So the problem of struggling to go and collect information about who is poor and who is not poor, who is disabled and who is not disabled, is offset from you. So you will have a fast and easy way of identifying your beneficiaries without having to incur costs, at least as at now. I don't know what is going to happen in the future, but as at now we are doing this pro bono to programs.
You being the communication officer, I suppose it is your job really to disseminate this information, and people will want to know really about the policy.
Yeah. Thank you so much. I think on the social registry, the M&E, and others, we will have subsequent programs where we're going to discuss them in details. We want in our subsequent programs, we'll have the SR unit, that is the social registry unit, sit here, explain to people in detail what is the social registry, what is available in the social registry, how can people access it. That would be a full program of its own. M&E, the same thing, and other systems. We are trying to disseminate information, trying to sensitize people to understand what our role is. That is the mandate of the Secretariat. Like Mr. Sonko said, the Social Protection Secretariat was established because there was weak coordination, because programs were fragmented. Now, it will take time for us to be able to bring these things together. That is why we have to build systems. And some of those systems is what Philly was talking about. It is important that we understand that a lot is going on. It will just take time for it to come out. But we are doing a lot, really. Sometimes back last year, we commissioned the National Social Protection Forum. The forum was meant to bring partners in social protection together to discuss on what activities they are doing, what are their problems, that is their challenges, what have they been able to do properly, so that we learn from each other. And in this way, programs will be able to talk to each other, and that will also minimize that fragmentation, and it will bring programs, it will bring synergy in program delivery. We also do conduct sensitizations to different regions. Just a few months back, we did one in the North Bank, where we sensitized the TAG and also the MDFTs. We want to do this more, so that people will understand what role we have, and then what are the programs, what role does the programs also have in the social protection policy. So the policy identify gaps, and it also identify target groups. And I think it is important that we highlight these things, that people understand that these are the gaps that led to the establishment of the Secretariat, because programs have been here even before the policy. So obviously, if we want to do things right, I think we need to talk to each other, and that is one main reason, those gaps. And the capacity to be able to do what you are doing is also another thing. Sometimes we do things, but we don't do them right, but we think we are doing them right. So therefore, there is a need for us to build the capacity of our own institutions, so that they will understand the work they are doing, how important it is, and how should it be done better. And in building capacity, is not only going to a classroom and sit down. Sometimes programs can sit down and talk to each other, and then that way we will learn from each other. Yeah, so you realize the finance is also a problem. That is money. Anytime you talk to programs, they will tell you, we don't have the required budget to be able to do A, B, and C. Yeah, so government equally needs to be engaged to establish a physical space where we will have financing social protection from government level, because government is the primary duty bearer. And in that way, we have to take the lead. So other bodies will only complement the UN system, World Bank, and all other institutions that are into social protection will complement government efforts. So this is why government is taking the lead. And in that, they came up with a policy, and they came up with a secretariat, and we also have ministries that are equally responsible for social protection. Phyllis said it here, we do not implement. What we do is coordinate. I don't know, Philly or Musa. We coordinate social protection programs. If you want to get cash transfer, please don't come to the Secretariat, because we don't have that mandate. Our mandate is to say, Ministry of Gender, you are doing A, B, and C. We believe we can do it better this way. Come to the social registry, get the information. The M&A team will go around, check whether what you are doing it very well, or not very well. They can also give you the feedback, you learn from that. So basically, these are some of the things that we do, and we are also trying our quota to make sure the information is heard from different angles. This is just the beginning, and I believe we are going to have a lot of them.
That's it. So here I'll bring Mr. Sonko, Mr. El Sonko. Of course, we've mentioned it before. One of the shortcomings is the lack of systematic data. How would you evaluate how far you've come from 2019 to now in getting the data on which the decisions will be based?
Okay, thank you very much. I think that's a very important question. When we came in 2019, there was nothing like a social registry. We are trying to build the first ever social registry, Gambia social registry in this country. With the social registry, what we have done basically is, we don't do this in isolation. We all know GBOS, Gambia Bureau of Statistics. We work with them, we work with other partners, and GBOS led the data collection. We were able to collect data from 36 districts in this country, meaning almost 40% of the population here is being covered in terms of data, and that data is housed at the National Social Protection Secretariat. He's the social registry manager. We are able to achieve that. Today, if you come to the Secretariat and then you need data from those districts, we can give you much data on those districts. So that means we have gone so far with the support of the government, with the support of other development partners. In terms of data, as he said also, we are able to conduct the National Social Protection Forum, first ever forum in that manner. At that forum, we were able to make institutions interface, sit down together, discuss their issues. And what we realized is there are institutions almost doing the same thing, but they were not communicating. And they were able to communicate, and there was synergy. And today, some of those institutions are working together. We are trying to extend this also to the regions. We are planning to have a regional forum where we'll be communicating with the governors and start to establish ourselves at grassroots level so that they also know what we are doing. So, and then we also have, Phil would like to shed light on that. We have started developing a data sharing protocol so that data we have would be shared with others. But these are individual data. These are data on personal data. So when sharing data is very important, but how do we share this and make sure each party conform with the memorandum of understanding that we sign? We are going that far also to get that done. So basically, data is coming up. We are still not perfect. We still have so many districts to cover or a population to cover. We still left with the combos, the KMCs, the Banjuns, where we assume that almost 60% of the population is residing. We are yet to collect data on that. But definitely we are working with partners. They are trying to help us in that domain. Hopefully data issue, we'll try to address it in the coming years.
That's it. Mrs. Siso, you want to come in here? Yeah. I mean, we read, for instance, during the COVID-19, when we came up with that relief package, according to the World Bank, some of the targeting, the wrong targeting approaches, as it were. So how would this new system help to make the whole process more efficient?
Yeah. So you're right. When COVID struck, we had the problem of who to target because there was no data. Government was trying to decide whether to provide this to the entire population, but the budget cannot accommodate that, and so they have to find a way of targeting the most vulnerable communities, and there was no data to inform that. And it became a challenge. Eventually, the food assistance went on. I'm not sure how it ended up being distributed, but it actually was delivered. The social registry, it was out of all those lessons that we thought having the social registry is important. So we collect information from households as well as from every individual within that household about so many things about their demographic information, their education, their income status, their employment status, their ability to cope with shocks, their health and disability, their whether they are farmers or not, etc. And this information is all put in a system that is going to help us to categorize people into different classes: extremely poor, poor, and non-poor, based on a certain benchmark that is agreed by government. So the poverty line for this country is determined by the national, the Gambia Bureau of Statistics. They are in charge of that. So we use the poverty framework, the formula for calculating poverty in this country, and select variables that are highly correlated to poverty and put it in a model that we call a proxy means test. It's not exactly a poverty estimation model. It's just a model that gives us an idea of who is poor and who is not poor. And based on that model, some people are categorized based on the information that they give us, categorized as extremely poor, some are categorized as non-poor, and some are categorized as poor. And if we have if programs come to us that want to target the extremely poor and or want to target people who are poor and they have a budget limitation, we make sure we prioritize the extremely poor. If they're able to provide for the extremely poor and the non-poor, I mean the poor, we provide that data. But depending on who they want to provide, we give them that data. So imagine we have such a system in place, government would have found it very easy to target that food relief to the most extremely poor households and individuals in this country. So the social registry is going to be very helpful in our future programming and planning, in program design and implementation.
That's it. Yeah. So when you have a multiplicity of inputs, they will get the information from you. You have all these different agencies. They will come to you for the information so that there wouldn't be any overlap.
Exactly. Yes, exactly.
That's the idea.
Maybe I should also add that the social registry could also categorize, provide information about households based on different criteria, not just poverty. We could use education level as a yardstick to target, our beneficiaries. Programs can come to us and say they want to target lactating mothers, and we can say who is a lactating mother and who is not. There could be a child grant support to children, and we can inform them about who is poor. I mean, who has a child and who does not have a child, based on the data that we collect. So based on the criteria of different programs, we can provide data to help identify beneficiaries for those programs.
I think that one is in response to the policy target groups. The policy is targeting extreme poor people, households and individuals. Again, it is looking at vulnerable children. And if you look at another target group would be the elderly. The list goes on. So these are variables that you can find in the social registry. And I can see Mr. Boyd is very passionate about the social registry, and I believe maybe you would have more than one program on the social registry to be able to exhaust it. It's a massive system that has been developed, and I know anytime it is completed, it is going to solve a lot of problems that programs are facing. And not only the social registry, we also have a lot more in store that will come out very soon. Sure. The M&E framework, which is going to be able to monitor all social protection programs and communicate feedbacks. We are also developing a financing strategy that is going to determine, or that is going to say how social protection programs should be financed. We have a cash transfer committee that is going to say, you are giving cash, what is the national baseline for cash transfer? How much should we give as a transfer? If all those things are ready, I think it's going to solve a lot of problems for the poor, who are actually in a very bad condition, and they need this kind of supports. So we have a lot that is in the pipeline, and we believe in this near future, these things will all be in the open for people to access.
That's it, and your unit, the M&E, will be crucial for trust between the state and client and people in this regard, wouldn't it, really?
Yes, as you said rightly, first is to bring in the value for money. People pay for something based on relevance. There must be value for money. What we are trying to do is trying to develop an M&E framework. In this framework, it's not going to be barely social protection secretariat's framework. It's going to be a national M&E framework where other partners would have indicators that would be monitored, tracked, and see how best do they move with the progress over the years. With that indicator, we realize that reporting would be harmonized. People will report on that framework. So that means if there are reports produced in the framework, we can definitely see which agency, which organization is operating where. And that means that will reduce the duplication of efforts in certain regions. With indicators also, we'll be able to see which target groups, as he rightly said, are being targeted at this juncture, and which target groups are left behind. With that framework, we'll be able to do that. With that framework, we'll be able to know who are the beneficiaries generally and where are these beneficiaries geographically. We'll be able to know that. And then again, with the framework, we'll be able to know how much are we spending in terms of social protection programs and projects. How much are we spending as a country? How much are we spending as a development partner? How much are we spending as an individual? Because we know social protection interventions, there are associations, there are individuals coming in, there are agencies coming in, there are development partners coming in. What we are trying to do right now is to map them out and see who are these people, who are the players into social protection. Because in order to coordinate well, you must know your players. As a coach, you must know all your players. So we are trying to map out where are they. If we are able to see all the players, then we will be able to coordinate them well. As he rightly said, we don't intend to implement activities directly in the communities. What we try to do is we try to bring those players, the implementing partners, to see each other and know that this is where I can operate and this is where others are also operating, so that they are able to work in harmony, and also the resources will be well utilized. There will be efficiency in whatever we do. But if there are duplications and continued duplication, there will be overlaps, and then resources would not yield what we expect. So basically in the M&E, we want to track every activity, every intervention. What are we doing on those other interventions? And not only to follow them up, how far, but we want to advise them to see their mistakes and make corrections as we move on. Because the whole target is one Gambia, one individual in this community that we are all targeting. So programs should be able to speak to each other and target the same individual. Basically, this is what the M&E framework is trying to do.
Yeah, oh, absolutely. And here, continuing on the sports metaphor, sometimes when you do not select a player, he becomes aggrieved. So it brings us to the grievance.
Exactly.
To the grievance and redress mechanism inbuilt, which is very important. Take us into that.
Yes. So, like I started earlier, as social protection interventions are being implemented, so also are complaints coming up. People are saying, I am not included, I am not excluded, I am eligible, or your staff are not acting properly, misconduct and all whatnot. And we feel it is important to put up a systematic mechanism that is going to handle those complaints, those grievances, because they could grow out of hand and become conflicts. In some instances, when people are not beneficiaries of interventions, they would blame this on politics, for example. They would blame it on their local leadership, when it would have nothing to do with that. So it is important that we institute a system that would receive those complaints and address them systematically. That is what grievance redress mechanism basically is. Some would call it case management or complaints feedback mechanism. And because we are a coordinating institution, we are trying to build an integrated grievance redress mechanism that is going to take care of all grievances relating to social protection interventions in this country, so that if intervention X is providing cash transfer or intervention Y is providing support to breastfeeding mothers and people have complaints about them, they could reach our structures and lodge these complaints, who would take actions to addressing them, whether this would be at their own level there, or whether they would escalate it to the regional or national level for appropriate action. So since our establishment, we have initiated the establishment of an integrated grievance redress system or mechanism, which involves committees at community levels, at district levels, at regional level, and also at national level, so that grievances that can be addressed at community levels are addressed by our committees at that level, and those that cannot be addressed at that level but at the district level could go to the district level for appropriate action to be taken. And we have, because it's a new concept to so many people, we hired the service of a consultant who supported us to develop a manual that guides the operation of these committees, and we provided training to them so many times. We did about 3 rounds of trainings, sensitization and trainings, so that they would know what actually they need to do. In addition to that, we have also procured a toll-free line that people can call for free. It is 1229, so that for sensitive complaints, if I don't trust Mr. Bush to report my case to, they could call directly and lodge that complaint, and appropriate measures will be taken.
And it's free.
Yes, and it's entirely free. You don't have to pay anything from any GSM line that you call from. So basically, that is what the GRM system is about.
Yes, and unit, the communications unit. So this feedback loop between the administrators and people, very important, isn't it, in the administration of the whole scheme?
Yeah, sure. The grievance redress mechanism is under the social registry. They have, currently they are supported by call operators. We have 2 personnel who are sitting only to receive calls and then analyze it. And then we are thinking of getting a GRM officer, possibly around next year. That is going to support us able to get all the relevant informations, because these are things that are very delicate, because you're complaining about somebody who might be powerful, and it can boomerang, or the feedback may hurt those that are complaining. So we need a comprehensive system that will be able to solve all those problems. But we are having a consultant that is supporting him supporting us according to him. It's helping us build the system in a way that if you lodge a complaint, there is a number of days that your complaint will be addressed and you'll get the feedback. So which is very perfect. So with that, people will have trust in lodging complaint, because if not, we will still continue to cultivate the culture of silence. Like he said, the number is operational. You can call it anytime. If you have any complaint, you can call the line. But presently also we can assure people that the Secretariat's website is ready. If you want to have more information of our work and also the social protection sector in the Gambia, you can log into www.nsps.gm. It's ready and functional. You can access some information on it. So we will go before the data collection with the support of the Department of Information Service. They help go around to sensitize the communities that data collectors are coming for the social registry. So in that way, the information you are giving to GBOS personnel is information that you understand, is information that you can verify, is information that we believe is right, because we already told you data collectors are coming. What purpose are they coming for? What are we going to use this data for? So we encourage people to give the right information. So we are trying to raise awareness on all these institutions, all these instruments that we have, that is the GRM, the social registry, the M&E, and also other things. Currently we are having a consultant. We hire the service of a consultant with support from Conseil Santé, that is an EU project, technical assistant to the social protection policy. They are doing a communication strategy for social protection. We, the Secretariat, are the implementing arm of the steering committee for the policy. So obviously the strategy would be there for us to use in being able to coordinate social protection programs. Other partners can also look into the strategy and also use it as a means of communication, so that we will effectively disseminate information that are right about social protection. Today, if you want to send somebody outside to go and talk about social protection, possibly, even if you have an understanding, he might sell a wrong message. So I think we need this strategy so that, we will be able to send the right message for the people to understand. Yeah.
That's it. And I suppose here, M&E, you're going to have to hold their feet to the fire, as they say, especially with GRM,
yes,
to make sure that, the toll-free line is working, and then they act upon complaints, so that redress, as it says, there will be redress.
yes.
So that would be your function, wouldn't it?
I think I will pick it from there, acting upon complaints.
Yes.
We want to tell the public that not every complaint would be addressed at the Secretariat itself. We have referral pathways where the officers, upon receiving the call, can either refer it to another institution depending on the magnitude and the type of complaint. Some would be related to the project in which we are overseeing, some may not be related to the project directly, and then they will refer the case, but we'll make sure that there is feedback to you at all times. So it doesn't mean that all complaints would be solved at our level, but we can refer some. Coming back to the data, as they rightly said, we do the data collection, but also we verify this data. We call it data validation. There are agencies and organizations that uses our data. Before utilizing the data, we make sure we verify and validate this data at community level. For example, if we receive data from QCell Village, we'll go back to the community and tell people these are the people who are identified as extreme poor from our system. He's mentioned the PMT. Do you agree or disagree? Because just to verify that what we are doing is right. And most often, communities would agree on the list and says, yes, the list you provided, yes, in our community, in our locality, these are the people we also term and assume as extremely poor. So that means that gives us the power, the mandate, the confidence that this data can be usable by many organizations. So the data is always there, and then it's a valid data for now. And we are also ready to go on updating this data because we know data collected in 2000 or 2001 by 2023 or 2025 would be obsolete. So that means we need to go back to those communities and collect more data to update the system. So we'll be doing that update, and then that means people can always count on us, especially in areas where we have done this data collection. For the M&E, we'll always follow them up and see how things are working. We are not police, actually, but we are trying to see how best and what progress do we go forward to. Because if you don't actually measure your progress, you can't know whether you get your success or your failure. And definitely, if you don't know your success or your failures, you may probably rewarding failures. So if you want to know that exactly, that you must measure your steps and probably reward the successes instead of rewarding the failures. So this is why the M&E is always on them and following the successes.
That's it. But here I have to say that every mandate really comes with funding. One wonders how much the fact that most institutions will complain about being resource-strapped, how much that is hindering the work that you need to do, given the scale, the size of work you need to do, how much funding or resources is helping or hindering your work?
Yeah, I think as a developing country, resources will be a challenge. As of now, our intention is to have the social registry data collection nationwide, but due to funding constraints, we are only able to do 36 districts, and even this we have to phase it. We did the first phase that covered 30 districts, we did, and then extended it to an extra 6, and now we are trying to extend it to an extra 2. Our wish is that we, roll it out nationwide, but funding is limiting that. So that is one way that funding is challenging. Also, if you look at the sector generally, you would observe that the kind of social protection support that is very prevalent in this country is one that is emergency oriented and very short term. And these all have a link to the resources that is, that is available to these programs. Even if you want to provide cash transfers to every extremely poor household in this country, the budget is not there to support that. Even in the national budget, we are struggling to make sure that allocations to social protection interventions increase, but there's a competition even for that, because everything is a priority. Health is a priority, although some health interventions are social protections themselves, but other sectors also need money. So yes, we have a lot of funding challenges, but we appreciate the support that we are receiving from our partners, it's UN agencies, and especially the World Bank. Right now we're having a lot of support from the World Bank to, in fact, all the data collection that we have done in the 36 districts, as well as the extension into the 2 districts in the Combos, is all funded by World Bank. And even the public information campaign that usually precedes this data collection to raise awareness about what the social registry is, about the data collection, and how there is the need to give factual information, is all funded by the World Bank through the Social Safety Net project. So yes, we have resource constraints.
That's it. And the communication officer, I wonder what's your penetration level of going around the country, letting the people know what the policy is about?
We are yet to, that's a constraint. We are yet to be able to have a very good coverage on that. As of now, we are only able to do it in 1 region, and that is the North Bank. Before the end of the year, we are expecting to hold, if possible, 2 regional forums. They are all going to be in the regions. So that way, we will be able to cover a good number of people in the regions. But equally, the Secretariat have appointed social protection regional officers who are going to be based in the regions. So obviously, we will have our representatives in the region who are going to mirror the central coordination to the regional areas. These officers will be based at the governor's offices, where they will be working with partners that are at the regional level. So most of the things we will be communicating to them, because sometimes it will not be that easy to conduct all these activities very frequently as we would want them. But if they are there, they will be able to do some of them. Possibly next year, we will conduct a lot of sensitizations in the regions. That is to either train them or sensitize them on the policy and also other things. Currently, the policy is being reviewed. The midterm review is on. The consultant is hired to check from 2016 up to 2020, 2021, or 2022, what is the level of coverage? What is the level of implementation? Now, that review will give us a new energy and direction to make sure that we implement the policy as it is supposed to be. Because after the policy was conceived in 2015, 2016, you realize there were some bottlenecks in trying to implement it. Even the Secretariat is one of the recommendations for it to be established. But it was until 2019 that it was established. So you will realize, yes, we have some successes, but equally there are challenges in the implementation of the policy. But we will try to improve the communication aspect of it to all the population, not only the region, but to the entire population.
That's it. But I wonder here, Mr. Sonko, with some of these shortcomings, how does it affect the M&E process, I wonder?
Okay.
Does it affect it at all? How does it?
Yes.
Because we have certain structural problems, don't we? So how would it affect your monitoring and the evaluation?
Yes, we also have constraints, but first I would start with the financial issue. Some of these constraints, we are able to identify them earlier, knowing that social protection is not a cheap adventure. We are trying to develop a financing strategy to see how best are we able to finance social protection in this country, both government funding, donor funding, private and individual funding. We are trying to develop that financing strategy to see how best is social protection financed. Maybe Philly would also want to add on. We are also thinking of a sustainability plan. He talks about World Bank supporting us here and there, but moving forward, how are we able to sustain the gains that we are making? So there is a study also on that to see we develop a sustainability plan moving forward. In our area as M&A, our main constraint is having institutions to report, because these are the reports we will gather for decision making. Reports coming forward are big challenges. That's where our main constraint is, because our power as M&A is the data, the information we get from people. Getting the reports from people are challenges, but we hope that with the full-fledged and functional, robust M&A framework, people would be mandated to report in that framework, and then a reporting issue as we move on, that challenge should be out of the show.
That's it. We're just coming to the end, towards the end. Sustainability, isn't it? Looking forward,
yeah.
just maybe a minute or so on sustainability.
Yeah. So I'll speak about sustainability of the social registry. We know the social registry is being the development of the social registry is being funded by a project supported by the World Bank. It is important that we make sure that after the project, the social registry doesn't die, and because of that concern, the World Bank, in collaboration with NSPS, commissioned a study on the sustainability of the social registry, and that relates to how frequently we update the data, how do we maintain capacity at the level of the Secretariat, so that even if somebody moves, there is capacity to manage the system. How do we make sure that coverage is not compromised? We don't just update for one region and the other regions are not. And they have recommended a number of options, maybe for example including the social registry questionnaire in the census, but there's a problem with that. The census comes only after 10 years, which is a very long period to wait to update people's information. In a matter of weeks, people's conditions change. Somebody could be doing well today, in a month's time he could change. So you cannot wait for 10 years to update that data. That is one of the suggestions. The other suggestion is probably to charge a decent amount on accessing social registry data, but that is not decided yet. So as at now, it is free. Let me say that so that all programs know it is free of charge. You just have to make a request, and we review your request to see that our data set can provide that. What you are requesting is within our data set, and we will provide that.
That's a fantastic place where to end it. We've come to the end of the program here,
Okay.
gentlemen. Thank you very much. I'm Mr. Filususo, the Social Registry Manager of the National Social Protection Secretariat. And I've got here Mr. Malang Jawa, the Communications Officer, and Mr. Musa El Suso, the Monitoring and Evaluation Sonko. Sorry, Mr. Musa El Sonko. He insisted on the L. The M&E Coordinator. Thank you very much, gentlemen. Thank you very much, viewers. Until next time, I'm Mamadou Boch. Goodbye.